Good morning, everybody, and welcome to the Health Transformation webinar. This is your host, Cade Archibald, and just delighted to be here with y'all this morning, and really excited to go over today's topic. We got some really cool stuff we're going to be covering on peptides for brain enhancement. So along with me, we got the one and only original gangster, just amazing individual, original founder of East West Health and Go Wellness, Regan Archibald. Regan, how's it going?
Really good. Really good.
All right. Well, yeah, I'm excited. This is probably one of the most fascinating topics for me to learn about is how to enhance brain function and just how to have optimal brain health. And so, yeah, I'm really excited about today's topic.
Great. Well, cool. As we dive into this, for those of you who have not been on our journey, the last month we've been talking about peptides, and we've talked about peptides for weight loss, for fat burning, peptides for growth hormone, for building muscle mass, peptides for digestive issues, peptides to remodulate your immune system like the thymosin alpha-1. And thymosin beta-4. But now today we're going to jump into my favorites, which are peptides for the brains. And these peptides are the ones I've used the longest for myself personally and for several of our patients. But they have phenomenal application. And as we go through these, I'm just going to ask you guys at the onset, how comfortable and satisfied are you with the way that your brain functions? Are you happy with your memory? Are you happy with your ability to learn? Are you happy with your emotional state? These are all components. Those three things, the learning, emotions, and memory, those are the three things we look at when it comes to overall brain health. And so it's so critical as we go through this that you just, kind of set some goals for yourself. How do you want your brain to function now? How do you want it to function 10 years from now, 20 years from now? Because I can tell you the number one complaint, more so than pain or anything else or energy in my patients who are over 80, it's brain health. And so this is going to be critical. And we had a big win this week. We had one of my mentors, Dan Sullivan. He came into the office, and he's the founder of Strategic Coach and has access to the best healthcare in the world, literally. And he came in and got treatments with stem cells intranasally. We did IV. And he said not only did his brain feel better than it ever has, his memory sharper, but his telomere length, which shows the age of your cells, his telomere length was able to shave off 10 years off of his telomere length. His bone density improved by about 20%. And then his VO2 max improved 25%. So pretty incredible if you look at all those outcomes.
Amazing.
And he's sharp too. He's on his game. So we've got him on the peptides too. And Cade, you've tried some of these peptides. And what's your experience like using Cmax, for example?
Yeah, so Cmax, did the intranasal mist, is that the only way, or is there a different form of Cmax?
No, you can do injectables too.
Okay, cool.
Sub-Q, yeah.
Yeah, so it just felt really nice on the brain. It was like calming, but also like really just felt very alert, just like clear thought process.
Yep. Yeah. It's a nice little boost. And so in the 80s, there's a Russian scientist, Dr. Guardier. And Dr. Guardier, he works with the athletes. And the Russian athletes are notoriously strong and just brute force. If you've ever seen Rocky, you know what I'm talking about. You remember the Rocky in Rocky IV, the big Russian guy, blonde hair?
Yeah.
Yeah. So I think of him when I think of any type of peptides or nootropics. And so what Dr. Guardier set out to do, he said, we've mastered the physical process with these athletes. Now we're going to start focusing on the brain. And so one of the first peptides they made was a peptide to help with brain-derived nootropic factor. And brain-derived nootropic factor helps with the neural growth of the brain. So it actually, the healthier your brain-derived nootropic factor is, the better your memory is going to be, the better your synapses will be. Emotionally, you'll feel just a lot more happy, a lot calmer. And then the NGF, which is neural growth factor, this means that new brain cells can come in and really start to enhance your overall ability to, have great cognition. So what they did is, there's a 2-day study of power plant workers, and they used Cmax for memory formation. And they used the 1 milligram dose 1 hour prior to the exam. And what it showed is the patients who actually received the dose had a drastic increase in correct responses. So just their ability for these, power plant workers, one of the toughest things is their circadian rhythms get off. And when your circadian rhythms get off, your memory starts to decline. And so they found that was a dramatic response just with the 1 milligram dose. So Cmax, they found is it can increase your brain-derived nootropic factor and neural growth factors by 8 to 5 times from baseline. Other studies confirmed that the brain-derived nootropic factor, it acts as like fertilizer for the brain to develop new neurological connections. So if you've had any type of stroke, trauma to the brain, Cmax is a great way to go. We have one of our patients who's a Canadian hockey player, and she was her goal is she's on the world team. She's a professional hockey player, and her goal is to make the Olympic team, and then for the Canadians to win the Olympics. And so what happened is she was in a game, and she got just nailed, gave her a concussion. And then 3 months later, she sat out. That's the time frame in most professional sports, is you sit out for 3 months. So she sat out for 3 months, and then immediately the very next time she got into on the rink, the hockey rink, she got another concussion, and then she never recovered. Her performance for about 6 months was just really sloppy. Her hand-eye coordination was harsh. She had to stay in bed some days all day, but most days about 12 to 14 hours because she had these horrible migraines. And it was one of our patients, Donna, who said, "Hey, you need to go see East West and get your brain treated." So she flew in from Montreal, and we treated her brain. And literally, it completely changed her life. We did the intranasal stem cells, and then we gave her the Cmax peptides. And this combination just put her right back on the hockey rink. To date, this was about a year ago. To date, she is thriving. She's better than she's ever been. All her stats have increased as far as hand-eye coordination, her physical fitness, everything's improved. So Cmax is a very powerful nootropic, great way to fix your brain and heal it. So in the Journal of Psychophysiology, they published a study on Cmax, and they found that those who are suffering from mental illness had noticed an increase in serotonin turnover, which is traditionally done with SSRI. So they found that Cmax actually has the same impact if you've got any depression or low serotonin production. Now, Cmax can be phenomenal. So Cmax it affects learning processes, exploratory behavior, regeneration and development, nociception. Nociception is your balance. So it's the tactile sensations that you have, like when you're gripping something, or your feet have a lot of nociception on them. It helps with inflammatory processes. It accelerates nerve regeneration, improves neuromuscular performance, processes of learning, and memory formation. So, Cade, is there any reason? Cmax is spelled SEMAX. Thank you for asking that. So, Cade, any reason why you would not take Cmax?
No, not that I know of, other than, if you're taking, is there any contraindications with like other medications or anything like that?
As far as contraindications, some of the peptides have contraindications, but the majority, there's no contraindications with Cmax. So peptides are very safe. They're protein structures and simple to make. It's just the way that the lab is sequencing these protein structures that makes it very powerful. So that's Cmax. So Cmax, very affordable. It's a great way to get your brain turned on. It helps with anxiety, memory. If you've had a stroke, nerve regeneration, strokes and concussions in the hospitals in Russia, they will use Cmax immediately when you've had the stroke. So definitely recommend if you know anyone who's had any brain trauma. ADHD, it's great with opiate withdrawals, ALS, Parkinson's, Alzheimer's. It's just an all-around amazing peptide. So
awesome. Hey, we had a question come in. So just, they may have missed something a couple sessions ago, but where do peptides come from? So the biggest thing that it's a prescription based, right?
It's prescription based, and these peptides are made from protein structures, and they can come from all sorts of materials. So they can come from pigs, they can come from certain human secretions. I mean, they are structured in, we only use peptides that are pharmaceutical based because the pharmacies have certain criteria they have to meet. So if you go and get like Cmax online, you can buy it on Amazon, but I don't know what you're getting because you want to make sure that the peptides are the purest form. And so that's why we only write the prescriptions for it, because otherwise you're not quite sure what you're putting into your body or into your brain in this case, because it's a nasal spray and it's very easy to take.
Perfect. Hey, Steve.
We got Steve. Steve, good to see you. Okay, synapsin. So synapsin, RG3 synapsin, this is a peptide that was created by Jim Lebel. And this is, if you look at this, this is more of like a vitamin combination. The peptides actually come from ginseng. And so what he did is he mixed the ginseng peptides, the ginsengenoids, with the B12, and then also with the NAD precursors. And so we'll talk about this, but synapsin is a phenomenal formula. It's Jim Lebel, he's gotten a lot of notoriety lately just for his discovery with synapsin. And so some of the research, what they found is that animals treated with one of the chemicals, which is the precursor to synapsin or to NAD. The precursor is called nicotinamide mononucleotide. And what they found is it enhances blood vessel growth and reduces cell death, and it boosts stamina and endurance and successfully reversing a key aspect of the aging process. So I look at synapsin and I say, this is a great way of preventing aging in the brain. We use it when a patient's had any mold exposure and they've got a lot of inflammation in the brain. But some of the components in it is the ginsengenide. These are the peptides that come from the ginseng. What it's been shown to do is support neuroprotection. What that means is your brain, if there's no protection on the neurons in the brain, then your brain is a lot more susceptible to stress. It's more susceptible to environmental toxicity. There's a lot of things that are going on in our lives and in the environment that can really start to diminish your ability to have good memory and good synapses in the brain. So RG3 synapsin, RG3 is one of the components of the three is the ginsengaside. These come from Panax ginseng. And what they're extracted from is, and why they're used is to support healthy microglial activity and healthy brain function. The nicotinamide riboside, this is phenomenal because it does support the neuro NAD synthesis without inhibiting sirtuin. So Cade, you've done NAD IVs direct. I've done it too. And NAD is something that we've looked at for longevity. We've used NAD to improve nerve function with our patients with neuropathy, even our patients who have cognitive decline. But what did you notice when you did the NAD?
Oh, sorry, I was on mute. And so with NAD, the IV, the simplest way I can think of kind of how it felt like while I was getting the IV, it was kind of like, all your cells are just like you're just like squeezing the toxicity out of those cells. And then once that like gets through your body, I was done with IV, felt like, just like really clean, a lot of energy. I know it activates your mitochondria and helps with that energy source of your cells. Yeah, it just felt like super energized.
Yeah, it's powerful. I mean, it hurts when you push it too fast. Cade was trying to break the world record. But man, it's a powerful pathway. And so the nicotinamide riboside, it's a form of vitamin B3, and this one actually comes from cow's milk. Don't worry, there's no casein in it. It's not like you're taking dairy, but that's how they extract it from. It also can be found in yeast and cultured human mammalian cells. So for those of you who have asked, this is where some of these peptides come from. Like I said, they come from very strange places. But the synapsin, the RG3 synapsin, this particular molecule has been shown to inhibit sirtuins. And so whenever you have sirtuins in your body, that's going to regulate metabolism and longevity. And so when you get hungry, when you get those hunger pains, Cade, I know you've experienced that before. About every 15 minutes, Cade gets them, from what I've noticed. And
yeah, it's a problem I have.
And when you get those hunger pains, your body instantly releases these sirtuins, and that actually calms down some of the metabolic pathways in your body, and then your body starts looking for other energy sources from your fats. So NAD is a great way of, a healthy way of burning fat. Methylcobalamin, I think a lot of us know about methylcobalamin. You probably know it from its easier name to remember, which is B12, vitamin B12. Vitamin B12 is necessary to convert homocysteine to methionine. And the important thing about this is if homocysteine is not getting converted to methionine, then it starts circulating in your blood and it causes chronic inflammation. And so the application of using the ginseng aside, those ginseng peptides with the B12 in the brain and the nicotinamide riboside, is that helps activate all the glial cells in the brain. And what the B12 does is B12, sometimes it's very difficult to get enough B12 in the brain. And as you guys have probably known, B12 is great for nerves, great for nerve function. It stimulates serotonin production. It also contributes to red blood cell formation and supports a positive mood. And so, yeah, this can be a phenomenal peptide for you to take. I love the RG3 synapsin. It was one of the first peptides I tried a few years ago intranasally, and it's phenomenal. Okay, we've got one more left, unless anyone has any questions before I move on to Cerebral Ison. Now, Cerebral Ison is really exciting because, once again, a lot of studies around these peptides. These are not, when I'm throwing out the benefits of using these peptides, these actually are clinical trials that have gone on, clinical research that's been done. Here's one that's a randomized, placebo-controlled, double-blind, multi-center trial. And their conclusions with Cerebral Ison. Now, this peptide, for those of you who asked, you're going to be sorry you asked, but this peptide actually comes from the hypothalamus and some of the structures of the pig. So it comes from the brains of the pig and the hypothalamus of the pig. So once again, these are just peptides that they're extracting. So Cerebral Ison, what they found in this placebo double-blind study is that it had a beneficial effect on the function and global outcome in early rehabilitation patients after stroke. Its safety was comparable to that of the placebo group, suggesting a favorable benefit to risk ratio. And they also found that, they want to do more. So Cerebral Ison, they found it helps with dementia, Alzheimer's disease, mild cognitive impairment, recovery after stroke, traumatic brain injury, spinal cord injury, ADHD, treatment-resistant depression. So Cerebral Ison is one of my favorites. And literally, when I got Cerebral Ison, the first few times I got it, I could feel my brain tingle because it is a subcutaneous injection. It's not a painful injection, but it does sting. But almost immediately I could feel the blood tingling in my brain. It was the most interesting thing that I've had happen. But it was almost like my tank was a little bit low, and then it just filled up my tank, because I don't get the same sensation now. But I have a lot of my patients, especially, one of my patients has ALS, and that's exactly what he notices, that it just creates this nice infusion right into the brain. Cerebral Ison, because of its size, these are very small peptides from the brains of pigs. It can cross through the blood-brain barrier. It also gets into the blood cerebral spinal fluid barriers and acts directly on the central and peripheral neurons. So anyone who's got any kind of inflammation in the brain, this is a great peptide for you. Studies indicate that Cerebral Ison is safe in humans for short-term use up to 3 years. It's not been approved by the Food and Drug, the FDA. A lot of these peptides, the FDA has just said, yeah, as long as they're produced in a lab that has the GMP standards, and it's a CLIA certified lab and pharmacy, then it's fine. Otherwise, they haven't really used it to target any particular diseases otherwise. So Cerebral Ison. So here's the difference. And Cade, this is probably what's on a lot of your minds is, where do we start? Do I use Cmax? Do I use the RG3 synapsin? Do I use the Cerebral Ison? And so kind of a way that I like to structure it is, if you have something that is farther down the pathway, more chronic, Cerebral Ison is the way to go. Cerebral Ison is going to be more expensive than the Cmax. Cmax is simple because it's a nasal spray, and it's a nasal spray that costs around $50, maybe $60, and that's it. Very well tolerated, easy to use. The RG3 synapsin, depending on the pharmacy that we use, it can be anywhere from $60 to $120. And the Cerebral Ison can be $120 up to $220. But if you have something that's farther progressed, like a dementia, you've had, patient comes in with a stroke, they've had a pretty significant traumatic brain injury, that's where we would say we need you on the Cerebral Ison. If they have ALS, ADHD, this is going to be key. Our kids who come in and have treatments for like ADHD, autism, we say Cmax is the easiest route if they're willing to spray it in their nose. Sometimes it's difficult to get them to do the little inhale, but it's easier than trying to give them an injection of Cerebral Ison. RG3 synapsin, that is something where we use if you've had some type of chronic infection, if you have some nerve impairment like numbness, if you tend to be anemic or have autoimmunity, and you got brain fog from like a thyroid condition, that's where the RG3 synapsin would be very key. Even if you've had some type of digestive issues, because if you have like leaky gut, or if you've had a lot of glyphosate exposure, that will bind with your B12, and so you'll end up B12 deficient. But even if you've had mold exposure, the RG3 synapsin is my favorite as far as turning on the brain. And then the final one with the Cmax is, like I mentioned, if you've had something that's more acute, or you're just looking to enhance your brain function, you just say, look, I've got a test coming up, or I just want to feel more mental clarity, and I want to do something that's going to be good for my brain in the long run, more that preventative. I think Cmax, as far as bang for your buck, Cmax hands down is what I would do if you're just looking to enhance your overall brain performance and just to get you on your game. So hopefully this has been helpful. Cade, did we have any questions coming in before we finish up here?
No, I think you've covered them all.
Okay, beautiful. So yeah, the next step for each one of you is, like I asked you in the beginning, is, hey, how do you want your brain to feel? What are you looking for? More serotonin, that may be where, the Cmax, the RG3 synapsin is going to be a little more on that. more dopamine. Serotonin is going to make you feel good, connected, happier, positive mood. The cerebral ison is going to be a little more dopamine focused, so you'll be able to execute on plans quicker, make decisions faster. That might be better for you. And then if you're just really looking to have more relaxation and just better, kind of clear the fog, better mental clarity, then the RG3 synapsin. So let us know what you'd like. And next week, what we're going to be diving into is some new research on exosomes and how exosomes, which are signaling properties from stem cells, how they can activate all of the progenitor and stem cells in your own body and your own brain. So this is a big medical breakthrough. The peptides, the exosomes with the stem cells has been very exciting for us here at East West. So we'll look forward to seeing you next week if we don't see you in the clinic before then. So thanks, everybody.
Awesome. Thanks for joining us, guys. We'll be back same time, same place next week. Bye-bye.